Okay. Oh, hi. Sorry you're already here. I am sorry about the wait. It's not normally this long after a full moon, but seems like it was kind of a difficult moon for quite a few people. Maybe for yourself too, huh? No. It's okay. It's nothing to be ashamed of. Looks like you've still got some wolf features here that haven't quite gone away. Don't worry, they will. Everybody detransitions at a different speed. Perfectly normal. But let's take a look. Let's do your checkup and make sure that you're feeling okay. All right? Okay. Could I get your first and last name, please, and your birthday? Okay. All right, perfect. And your wolf day? Oh, sorry, no one's used that term with you yet. No, totally fine. That's the day that you became a werewolf, that you were changed. Some people were, born a werewolf, other people were changed. It's okay if you don't have the exact date, but just kind of an estimate. Okay, perfect. So you are pretty new, huh? No, that's fine. Nothing to be ashamed of. It's one of the nice things about having a pack is that you have wolves of all different experiences, and the older wolves can help to help out the younger ones. Do you know the wolf it was that sired you? Oh, okay. Okay. Now, if it's all right with you, I'd like to just ask a few questions about your transition this time, okay? This last full moon. And we'll go from there, okay? Okay. How much do you remember from your time as a wolf? Do you remember everything vividly? Do you have little snippets of memories, just kind of images and feelings, or nothing at all? Okay. That's to be expected for such a new wolf. It might get a little better as you transition more, but some wolves never really have total recall. That's okay. All right, how does your memory compare to your previous full moon transitions? A little more, the same, less? Okay, good. How would you rate your pain level from this transition? Yeah. Unfortunately, that's never going to completely go away, but again, the more that you transition, the more your body gets used to it. Is that a higher or lower pain level than previous transitions? Okay, good. All right, and how about right now? What would you rate your pain? Okay, do you have any injuries or wounds that happened while you were in wolf form? Obviously, we all know that those transfer. Of course, the first few days after the full moon, you'll have heightened healing abilities, but I can still definitely look at anything that might need some attention. Okay, sure, just a little scrape there. Nothing that we can't handle, okay? All right, well then, I think we'll start out just with a visual inspection. Make sure that that little wound is the only one that we see, and then we'll go into the rest of the appointment, okay? All right. Now, how are the lights here? Is anything too bright? I know that some people can have some really severe sensitivity to light or to sound after transitioning, so I try to keep it kind of dark and kind of quiet in here. Okay. Is it all right if I use a little bit of a flashlight to take a look at you? All right. If at any time it hurts your eyes, just let me know and I'll put it down, okay? All right. Just want to take a good look at you around here. Make sure that I don't see anything obvious. Still got a decent amount of fur here. If you'd like, I can kind of brush that out for you. Check you for ticks and lice, too. Unfortunately, that is something that we have to worry about, especially right after a full moon. Okay. I think the only injury that I'm seeing is this one on your arm. Yeah? Anything else feel, I mean, you might be sore, but anything feel particularly in pain? Okay, sounds good. Let's just clean up that then. Okay, I don't see any other injuries. Could you turn this way for me? Okay, turn this way for me. Okay, sounds good. I think it is just that one. That's good. Alright, let me get some ointment here. Okay. Yeah, put some gloves on, and we'll take care of that wound, okay? Now, got a little bit of a disinfecting, cleansing ointment here, okay? Just gonna get some of that out. Put it onto clean little cotton around here, okay? Now this should cleanse the wound, and it shouldn't sting, but please let me do if it does, okay? Okay. I can see your arm, please. Alright. Just going to put that on there. Doesn't look like it's very deep, which is good. You must have not gotten into fights with any other wolves while you were changed. Oh, there's a few every time. That's alright. It's one of the reasons that we all come to this wildlife sanctuary, so that we aren't attacking humans or anything like that. It's just us here. There we go. Does that feel okay? Alright, good. If you'd like, I could put a bandage on it too, just to make sure it doesn't get infected. Okay. Alright, about your arm, please. Just wrap this up. There we go. Okay, it should be kind of snug, but that's not uncomfortably tight, is it? Okay, good. There, should be enough. There we go. Just tuck that in. There. That should stay nice and secure now. Alright. So we checked you over for wounds. You said no other injuries that you know of. Good. Alright, now I'd like to just check your vitals, okay? Listen to your lungs, take your temperature, things like that. Okay. Obviously, these might be a little different, seeing as you were just a wolf, but we just like to monitor, make sure everything is okay. Alright. Just going to hold this over your heart, if that's okay. Alright. There we go. Good. I think that's fully transitioned back. That's good. Alright, now I'm going to listen to your lungs, okay? Would you take a deep breath for me? Good. And again. Good. And again. Good. One more time. Good. Now just breathe normally for me. Good. Good. Everything sounds perfectly normal. Always a good sign. I'd like to get your temperature too, if that's all right. There we go. All right. Open up, please. Just under the tongue there. There we go. Just sit for a second. Okay. Heart and lungs. Good. All right. I'd like to just take your pulse too, if that's all right. Can I have your wrist, please? Okay, thank you. All right, good. It's still a little bit high, but that's understandable after a transition. Not high enough that it's concerning. Oh, let me check that. There we go. All right, good. Temperature also in the normal range for a wolf. That'll change and level out a little bit too, but not concerning in any way. All right, now if you would like, I could take a look at that fur for you. Just make sure there isn't any lice or ticks or fleas or anything like that. Okay. All right, I've got this little comb here. It's a sterile comb. It just is going to help me brush through your fur and make sure that there isn't anything concerning, okay? All right. Just hold nice and still. You don't have to do anything. I'm just going to be combing through. If I see anything, I'll let you know. Don't worry, we have plenty of different shampoos and treatments to get rid of things like lice, or ticks, or fleas, or anything like that. Okay, good. Yeah, I'm not seeing anything concerning. No eggs, no mites, no bite marks on the scalp, nothing like that. Good. Have you been feeling itchy at all? Okay, good, good. Alright, I'm just going to come over to the side here. Just over here. Good. Still not seeing anything. Excellent. Your fur actually looks like it's in really good shape. It's not that tangled. Yeah, sometimes wolves come in and they are pretty messed up. Not messed up, but just very dirty. Their inner wolf, I think, enjoys a mud bath. Or running through the brambles or something like that. Little tangle there, sorry. Not seeing any cause for concern though. It's very good. Very, very good. Okay. Did any of that cause any sort of irritation on the scalp? Good. No, it shouldn't, but if it does, I can certainly do a scalp examination too. No, I think you're looking just fine, plenty clean. Good. Good, good. Right. Now, is it alright with you if we do a bit of an eye exam Okay, I know, again, I don't want to irritate your eyes, so if this is too bright, that's okay. But I would just like to take a little look, okay? Okay, just a second. Okay, so starting out, we're just going to do a visual inspection and check your peripheral vision, your reflexes, things like that, okay? All right, is this light okay? Okay, good. Just going to shine this around a little bit, see how your pupils are reacting. Good. You can just look right at my nose for this part, or pick a spot off, that's fine. Just want to see how those pupils are doing. Okay, good. Pretty good reaction time, actually. Good, 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 good. All right, now I'm going to move my light out of your vision, okay? I want you to just look right at my nose, but tell me when in your peripheral vision you can't see the light anymore, okay? Just tell me when the light goes away, okay? All right. Good. 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 All right. Wonderful. Now, I'm just going to hold my hand right here, okay? I'm going to test your consensual pupillary response. Good. Good. Okay. Good. Good. All right. Now I'm going to tell you to focus on different things. Either focus on my finger or my nose or the light. Okay, I want to see how your eyes focus on things at different depths. Start out looking at my finger right here. Good. Now look at the light. Good. Now look at my finger again. Good. Now look at my nose. Good. Now look at the light. Good. Now look at my finger. Good. Now look at my nose. Look at the light. Look at my finger. Look at my nose. Good. Now look at my finger. Good. Look at the light. Good. Look at my finger. Good. Look at the light. Good. Look at my nose. Good. All right. Let's do a little bit of an eye chart test. This tests your vision, but also a little bit how your cognizant thinking is working. All right. Could you read this big letter for me? Perfect. And these two? Good. How about this third line across? Good. How about this bottom line, this line here? Okay. Okay. All right. All right. Good. Now how about the next row down? Can you make out any of that? All right, go ahead. Okay. Okay. Good. How about this bottom row right down here? Can you make out any of those? All right, go ahead and try that line for me. Okay. All right. Okay, great. It's looking like that is doing just fine. Some quick notes on that. All right. Now I'm going to take my light again, and without moving your head or neck too much, I want you to just follow the light around as it moves, okay? So just follow it with your eyes. Just follow that light. Good. Just wherever it goes, do the best that you can. Follow that light around. Good. Good. Good, good. Alright, keep following the light. Good. 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 any of that cause any sort of irritation? Okay, good. Good. Looks like you don't have too bad of light sensitivity after transition, which is good. What's your vision normally? Okay. All right, now this one, it might take a little while before this goes back to normal, which is perfectly fine. Just do the best you can, okay? But I'd like to do a quick color blindness test. This is often the last part of your vision that goes back to normal, from seeing like a wolf to seeing like a human. So just do the best you can. It's perfectly fine. If you do really terribly and you want to redo it in a few hours, we can totally do that. But just do the best you can, okay? All right, now this is a bunch of circles, but there should be a number in different colors in the circle. Can you see that? All right, what's the number? Good. How about this one? Can you see a number in there? Okay. How about this one? All right. All right, how about that one? Can you make out a number in there? Okay. This one? Okay. And this one? All right. This one? Okay. And this one? All right. There. Not too bad. Again, it's kind of coming back to you, but nothing that is concerning, especially not for a wolf who's as new as you. It often takes longer to transition back into a human when you first begin. All right, now I'd like to test your sense of smell and taste a little bit, okay? So I've got some smelling vials over here. All right, now, probably a little different than how you used to do this when you were just a human, but this has a certain scent in it. Don't worry about the color. The color is not associated with the scent. It's just kind of meant to throw you off. But instead of holding this right under your nose, I'm going to hold it a little further back and see if you can smell it, okay? All right. There. What does that smell like? Good, good. That one's cinnamon. I guess that one kind of does look like the right color. All right. Second one. You smell that one at all? Good. Yeah, that one's citrus. Specifically, I think it's orange. Nice job. And last one. There we go. You smell that at all? Blood, that's right. Can you tell me what kind of blood? Good job. Deer blood. Yeah. Well done. Okay, now I'd like to test your taste as well, okay? Just gonna take this, just put a little drop of this on your tongue. You don't have to tell me the specific flavor per se, but just tell me if it is sweet or sour or bitter or spicy or salty, okay? It's gonna be one of those 5 major taste buds. Hold out your tongue, please. Here we go. How did that taste? Good, that one was bitter. I like to do that one first because it's unpleasant. Get that one out of the way. All right, hold out your tongue, please. There you go. What would you say that one is? Sour. Right. Good job. All right. This one here. Right, tongue. There you go. What's that one? Salty. Good. Right, and this one. Sweet. Good. I bet you'll never guess what this one is. Just want you to at least make sure that you can taste it, okay? What is that one? Spicy. Good. Good, good, good. Is it too spicy? Are you okay? Okay. It shouldn't be that spicy. We try to make it that it's, you know, tolerable for everybody. Okay, good. No issues with smell or taste, of course. Do you mind if I take a quick look in your ears? Okay. I'm just going to use my light again, okay? Come over on this side. Just try to hold still for me. Any pain or pressure in the ears at all? Okay. Any itchiness? Okay. I'm not seeing any redness or tenderness. When I touch there, does it hurt? Okay. How about here? Okay, good. Yeah, I'm not seeing anything to be concerned about there. Alright. Let's check the other ear now. Alright, any pain or pressure on this side at all? Itchiness, irritation? Okay, good. Does it hurt when I press there? No? Good. How about there? No? Okay. Yeah, I'm not seeing any sort of redness, swelling, any sort of abrasions in there either. Looking good. Okay, perfect. Yeah, I don't see anything wrong with the ears either. Good, good. Alright, now I'd like to just test your skin sensitivity, okay? Here, I'm going to take two different things here. Alright, so I've got this little brush, just a very, very soft little brush here. And then I've got my tweezers, which are not like pokey, but have a little bit of a sharper end to them there, okay? So in a moment, I'm going to have you close your eyes. I'm going to touch your face with either the nice soft brush or give you a little poke with the tweezers here, okay? I want you to just tell me if it is soft or sharp, okay? That's all very simple. Alright, close those eyes. No cheating. Alright, just tell me soft or sharp. Good. 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 Well done. You can open your eyes. Alright, now I'm going to take this brush and I'm going to brush even more lightly on your face. Just the very, very faintest touch with your eyes closed. And you tell me where I'm touching your face, okay? Cheek, nose, you can say right or left cheek too. Things like that, okay? Alright, so close your eyes again. Just very, very, very light touches. You tell me when you can feel it. Good. 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 Nice job. Alright, looks like your skin sensitivity is perfectly normal as well. Alright. if I take a look at your teeth now? Yeah. Just want to see how your teeth are doing. You know, if the canines are still elongated, if they need any sort of cleaning or anything like that, okay? Alright, open your mouth for me. Just gonna take a quick peek in here. Yeah, definitely still got some elongated canines in there. Any sort of sensitivity in your teeth? Okay, sounds good. Looks like you maybe had a snack while you were in wolf form. Do you mind if we do a bit of a cleaning? It'll be really, really simple, don't worry. No intense tools or anything like that. I've just got some little at-home tools here. Of course, it'll be good to give your teeth a good brushing when you can. But I just want to test the sensitivity of your fangs, and then we'll clean off anything that might not need to be there. Okay, open up. Just take a look around here. Okay, any sensitivity when I tap on that? Okay. Side. Right. Good, good. Alright, I'm just gonna scrape a little bit on here. If any of this is causing any sort of discomfort, let me know and I will stop right away. Okay, good. Any sensitivity in the gums up here? Good. Looks like for the most part you do a good job taking care of your teeth. It's very good. Just want to make sure we keep them nice and healthy. Good. Alright. Do some more on the bottom too, if that's alright. Any sort of sensitivity there? Okay, good. Over here? Good. Alright. Not too bad on the bottom here either. Just a little bit. Just a little bit. Okay. Yeah, not bad at all. Good. Okay, looking really good. All right, well, that's all that I have for your checkup, as long as there isn't anything else that's causing you concern. The pain, yeah. Again, that's something that will get better probably the longer that you are a wolf, but it can be tough. That's why most of us stay out here for a full day after the full moon. Where do you work exactly? Oh, good. So your boss is a wolf and completely understands. Good. That's another nice thing about having a pack, is that you can find a job where it's going to be understanding about what you're going through. If you'd like, I could give you a little bit of a potion that will help with the pain just for the next few transitions. Okay. There we go. This is called a Starlight Potion. It should help with joint pain and soreness, muscle pain after transitioning, okay? You can take about a sip of this every 2 to 3 hours as you need it. Yeah, of course. Take that. Let me know when you need more. That should last you for probably a couple of transitions, but let me know and I'll get you some more, okay? Otherwise, there are definitely some supplements that you can take just over the counter too. Things like magnesium can help with joint pain. Calcium can help with muscle strength. Things like that. Or just a good multivitamin too. Actually, you know what? If you would like, I have some packets here. These are pre-packaged little vitamin mixes here. One of them is of multivitamin. 2 of them are performance mixes. So it's going to help, you know, it helps with energy, replenishing energy after your turn, but also very much helps, you know, alleviate pain and things like that in your body. And then there's an omega-3 in here too. So I can set you up with a set of these as well if you'd like to take them for the next couple of days. Yeah, of course. Just one of these in the morning with a meal. Everything in the packet, okay? All right, get you some of those too. Well, besides that, anything else that you would like me to go over or help with today? Okay, well, if anything changes or if anything doesn't change and you'd like me to take a look at it, we have some methods to help transitions go a little bit easier too if you need it. Right now it's not looking like anything out of the ordinary, but anytime that you have any sort of concern, you can come see me, okay? All right, well, why don't you get some rest? It's always very important after a full moon too. And I'll see you next time.